Welcome to Fundamentals Friday. I'm really glad you're here today. Today, we're going to break down one of the most important nursing skills you will ever learn, medication administration. Now, this is not just something you need to know for your exam. This is something that directly affects patient safety every single day in real life. And specifically, we're going to focus on the 6 rights of medication administration, the core safety principles every nurse must follow. If you truly understand this, you'll not only feel more confident in answering questions, but also more confident in clinical practice. Let's talk about why this matters so much. Medication errors are one of the most common and serious mistakes in healthcare. A small error, like giving the wrong dose or giving medication to the wrong patient, can lead to severe complications. That's why, as a nurse, you are the last line of defense. Before that medication reaches the patient, it passes through you. So even if a doctor prescribes something incorrectly or a pharmacy makes a mistake, it is your responsibility to catch it. That's why these principles are not optional. They are essential. And this is exactly how NCLEX tests you. Now let's go over the 6 rights of medication administration. Think of these as your safety checklist. Every time you are about to give a medication, you mentally go through each of these steps. If one is unclear, stop and reassess. The 6 rights are right patient, medication, dose, time, route, and documentation. Let's go through them slowly. Let's start with the first one, right patient. This might sound simple, but it is one of the most critical steps. You should always confirm the patient's identity using at least 2 identifiers. For example, their name and date of birth. Never rely on room number. Never rely on appearance. Never assume. Mistakes happen when we become too comfortable. Even if you think you know the patient, you still check. This habit protects both you and the patient. Next is the right medication. This means you are giving exactly what was prescribed. Always check the medication label carefully. Compare it with the order. This should be done at least 3 times. Check when you pick it up, before you prepare it, and before you give it. This reduces the risk of error significantly. Also pay attention to medications that look alike or sound alike. These are common sources of mistakes. Now let's talk about the right dose. This is where a lot of students make mistakes, especially during exams. You must ensure that the dose is accurate. If something seems too high or too low, do not ignore it. Double-check calculations. Ask questions if needed. Giving the wrong dose can cause serious harm or ineffective treatment. The next one is the right time. Medications are prescribed at specific times for a reason. Some need to maintain a steady level in the body. Some depend on meals. Some are time sensitive. Giving medication too early or too late can affect how well it works. So always follow the schedule and understand the reason. Next is the right route. This means giving the medication the correct way, oral, intravenous, or intramuscular. Each route has a different effect on how the medication works. So you should never assume. Always confirm. Giving medication through the wrong route can be dangerous. It is your responsibility to verify every time. Finally, we have right documentation. After administering medication, you must document it immediately. This includes what you gave, the time, the dose, and your initials. Documentation is part of the care. If it's not documented, it's considered not done. This can lead to serious issues, including repeated doses. In real clinical settings, things can move very fast. You may have multiple patients, multiple medications, and limited time. But no matter how busy it gets, these steps should never be skipped, because patient safety always comes first. Let's quickly review. Right patient, medication, dose, time, route, and documentation. These are your safety foundation. If you want to truly understand concepts like this and feel confident walking into your exam, we're here to guide you step by step. Pass your next exam using RN and LVN refresher online help from Gab-Nic Excelsior Nursing Tutoring Center. We're here for you.